You've probably heard about different variants of the virus. A variant just means that it's a slightly different version of the virus. And in fact, there are thousands of variants. The COVID virus, just like every other virus, changes all the time. When we start to talk about variants, we're really talking about when it changes in a way that makes it more of a problem for humans. So it might mean that it's easier to transmit or to give that virus to somebody else, or it might mean that it makes people sicker than the original version of the virus did. Or maybe it means that the vaccine doesn't work quite as well because this virus looks different enough that our bodies don't recognize it after getting the vaccine. So the Delta variant right now is one of the more concerning ones because it's so much easier to spread from person to person. It might even be twice as easy to spread from person to person. And that means it's riskier for all of us, even those who are vaccinated, because it's just easier to catch. It might also be making people a little sicker than previous ones. It's tricky for us to know for sure about that one because so many people are vaccinated and they don't get as sick, but it's certainly easier to catch. The good news is that the vaccines work very well against Delta. They're not quite as good as the other types because it's still easier to spread, but we've seen that still, over 85% of the time, the vaccines protect you even against Delta. So while we're worried about Delta for sure, the best way to protect yourself is to get the vaccine.